Hi, welcome to Gather. This is Anja.
Hello.
Am I saying that right?
Yes, Anja, yes.
Yes, see, nice, good. Anja is one of our therapists here at the gym, so you will describe what you do more effectively than I can, but go on.
Well, I am a massage therapist, but I do therapeutic massage.
Okay, and so if I had no idea what that meant, therapeutic massage versus normal massage, what's the difference?
I normally describe it as somewhere in between going to the spa and seeing a physio.
Nice.
So what does that mean? Well, therapeutic massage is very tailored to the individual. If you compare that to a spa, it would be a very general routine that they perform the same on everyone. My clients have some kind of issue, either it is a full-blown injury or it's just actually some pain somewhere or ache. Sometimes they have chronic conditions as well. And the therapeutic massage then helps relieve that pain, discomfort, and it helps the injury to heal as well.
Awesome.
So also I use a lot of massage as a foundational technique, but then I mix in other techniques from physiotherapy and osteopathy.
Right.
So that's how it would differ.
Yeah, so you've got loads of different tools in the toolkit, and we can deploy them appropriately. Yeah, which is great, because I think a lot of the questions we get asked, or I've been asked down my years as a PT is, which one do I need to see?
Yes, exactly.
Who do I need to see?
Sometimes, a lot of the times, I see people before they know where to go, and I can actually help with advising whether it's a chiro, an osteo, or a physio that I would recommend that they see.
Sure. Nice. And what is the most common thing that you see come to you?
100% lower back pain. That is 80% of my clients, and I mean, normally they have other issues too. They've got neck pain or stiff, between the shoulder blades, but lower back pain for sure, for so many different reasons, is the number one issue that I see,
Yeah, and obviously you work from the room in our gym as well as doing home visits and things. What's your view on training and lower back issues?
It's essential to train, but sometimes, depending on how acute it is, we might need to modify how we train, and we might need to add slightly different things into our training. And normally it's an imbalance issue as well. So, for example, lower back and glutes work very well together, but a lot of people have what we call sleeping glutes, so they are not working 100%. They're not firing 100%.
That's a far more polite way of putting it than say you have a lazy ass.
Yeah, and another client of mine who said, basically my ass is dead, but I was like, I wouldn't really put it that way, because it's not dead. But it's just not firing 100%.
And we talk a lot, and there's a term I think gets bandied around a lot, this, we're going to switch on the glutes before we start a workout and things. What's your view on that, I guess, as a phrase and also as a practice before you move into a workout?
I think it's very good. Activation exercises, I find, is a very good tool for people, especially with lower back pain. To switch them on so they are awake, then they are going to naturally help out in the compound movements a lot more.
And
so
is that
definitely
in your view, what makes that effective? Is it sort of reminding the brain that the glutes are there and sort of improving that relationship between the two and communication?
Absolutely. Mindful movement is for sure. I call it normally, like, we have pathways, like roads, but there are roadworks on that specific road towards your glutes, which means your brain has been wired to switch on other muscles instead. They are overworking. A diversion. Because the body will always choose the most effective way that takes the least effort. So by trying to work through those roadworks and remind your brain that your glutes are here. It's time to get off the beach, and sipping those pina coladas and time to do some work.
Awesome. Yeah, it's something we see. I think probably the two most common patterns that we struggle with is exactly that: people getting their butts switched on, sat like we are now. Obviously, it lengthens those muscles. They tend to get a little bit underactive, combined with tight hip flexors. You get the old hip clamp. We talk about that a lot. But the other one is upper traps, and where people just carry tension through it when we're around it over a screen all day, every day. Yeah,
it's interesting you say that, because a part of what I do that's different as well is that I treat areas that you won't get treated in a spa. So, for example, I treat glutes a lot, but I also treat hip flexors and diaphragm because of the posture you were just saying. And we're sitting with our hips flexed all the time. We get stiff and tight. So massaging the lower back or the back will help, but it won't be the long-term or a longer help with relieving the pain.
Is it sort of addressing the symptom rather than the cause?
Yeah, so then
I help them out of immediate pain. But
yes, exactly. So by thinking more long-term and thinking what's actually going on here, because we want to have I always want my clients to have as effective pain relief for as long as possible. And then I always tell them what's going on, what I've found, and I give them homework to do as well.
Nice.
But so treating the hip flexors can be interesting.
Yeah, I was going to say they're hard to get out and they're pretty stubborn, aren't they? Yeah.
But it is very, very effective, and people immediately notice the difference.
Amazing. That's really interesting. And it's always nice to hear, obviously, for us on the gym floor, is like the thing we're trying to do, that we're working in tandem with you. And I think that's one of the things I love about having yourself and the other practitioners we've got here on site, is that we can work closely together. You know, just this morning we had someone who's emailed us, one of our members, saying, I think I've got a herniated disc, so I'm going to get an MRI scan. I'm like, probably don't need to, like, you're still walking around. You know, why don't you come and see one of the practitioners here instead of getting a scan, which is just going to confirm that you're, probably, yes, there is some compaction around that, but how best are we going to fix it? And also, stopping moving is often the worst thing you can do. It's one of these myths, I think, that a lot of people fall into, and I think, unfortunately, our brains, we're looking for any excuse not to move. Ultimately, that is what our brains are conditioned to do still. So I like to do the practice, which I learned from a friend of mine, was that I'll sit down and make a list, right, what can I do in the gym today? And again, that's one of the perks of working with coaches rather than just coming and do your own thing, is that there's loads of stuff you can do always, and obviously the lower back is one of the trickiest ones to work around, but there's still so much you can be doing. Again, doing your rehab work instead of one of the heavy deadlift or a hip hinge pattern can be really helpful, because you just mentioned people come in, see you go and do this, and then they won't. So, and that's what's going to move the needle. I think people, as soon as the pain stops, it's like the iceberg's gone back under the surface. And they're like, I'm fine now. Like, no, it's still there. It's going to pop back up. If we don't address it and keep working on it. That's really interesting. And from my side of things, what I think, I guess I'd like to know about you is, how did you get into it? What's your sort of path into this?
Well, funnily enough, an injury, definitely. And it was in my SI joint, which is at the back of, at the back of the spine, by the glutes, but it was a lower back pain for me a lot, but even going into the glutes. But it was debilitating, and I worked in restaurant then, and on your feet all the day, and lifting heavy. I couldn't do any of that, and I went to see so many different people, and nobody could help me. And then I went on a journey to discover and learn about the body, and I helped myself, and then just always eager to learn about the body. I love the body, and I find it fascinating, because you never stop learning as well. Every client is unique, which is what I love.
Amazing. And it's funny, isn't it? I think that often the people that are the best when it comes to practitioners, in terms of empathy and understanding the situation, people coming to you in, helps you so much more effectively and be a more complete practitioner, rather than just seeing someone as a jigsaw puzzle to fix. There's a human in there too, and they've got all these other things going on. Helps you to to bring that empathy to the treatment. That's awesome. Cool. And if you had to pick like an area you want to move more into as your career moves forward, like what's the thing that really lights you up and you really get interested in? I know you mentioned like you're passionate about the body, and we're always finding out more about the body, which is something I love about it. And that's something we talked to about the personal training course we're doing here. It's like, here's what you need to put in the box, and here's what we now know, because it's all outdated, and there's such a pressure, and I think it's crucial for anyone working in this space to continue to upskill and their continued professional development. What do you see as like your niche? If there's an easy answer for you. Is that a really hard question I've thrown at you, Anja?
I'm not quite sure what the question is.
Yeah, like what do you, if you could choose one type of thing to do professionally, like there's a wide breadth of people you see and people you treat and people you work with, what is your absolute favourite, and what would you like to do more of, or dive deeper into that?
That's so difficult to say. I mean, I do love treating lower back pain because I can relate a lot. But I love that my job is varied, that's the thing. And I do love hearing people's stories and looking at the whole person and trying to adapt my recommendations and treatment to that person.
Right.
So I think I can't really answer that.
Yeah, but that's the thing, if you like the variability of it, I can completely get on board with that. I think so many people, it's quite nice to hear you say that, because I think most people go, I really want to do more of this and just one thing. But if you're treating the whole person, then I completely get on board with that as a view. And obviously the people we work with here tends to be, they're all very different. They're all different shapes and sizes, and that's one of the questions we get asked a lot, mainly because people get in their own heads. Am I going to be the least fit? Am I going to be the fittest? Like, doesn't matter. We'll look after you either way. But people that have quite general goals, I guess, of just wanting to be fitter, wanting to be stronger, and ultimately that is, I think, what most people want underneath everything else. So that's fair enough. And what a change, lower back, like we said, can be the most debilitating and restrictive thing.
Yes.
So if you can help people in that, then it's pretty rewarding.
It's very rewarding for sure, And I see a wide range of people. I see people doing sports and they come to me for that, because they get tight and for overuse. But I see then someone who doesn't exercise at all and have pains. So I just really enjoy all of it, to be honest. It's looking forward to meeting new people and hearing their stories.
I love it. And then sorting them out, helping them.
Well, as much as I can. And if they need to see a medical professional to get a proper assessment or diagnosis, then I will send them there and we can work together to help them. So
awesome.
So
I'm going to ask you now something more in my wheelhouse. What is your opinion of strength training? Is there, I guess the leading question, is there anyone who shouldn't be doing resistance training?
No, because the equation for happy muscles is not just releasing it, which is what massage does. It is strengthening it, because we get tight as well because muscles are weak. But I think what the common misunderstanding is that you have to actually use weights or be in a gym to do resistance training.
To create that resistance.
You can also use your body, or you can use very light bands, or but we should absolutely be challenging our muscles for sure. Yes.
Awesome. And in terms of that a lot of people still have this understanding that strength training or resistance training shortens muscles and can reduce your flexibility or your range of motion. Do you see that anecdotally, or is that?
The only time I see it is in bodybuilders who do not stretch. When they have to, they never stretch out the biceps, so it becomes shortened and they have to move like this through a door. But that is hours and hours and hours of training and, specific and avoiding stretching basically because they have to put in so much time into strength training.
Yeah, and I think with what we tend to see and what we're trying to encourage on the gym floor is like we want you to be strong through your full range of motion.
Yes.
So you know, we see a lot of people come in, for example, they've done, maybe they're really hypermobile or they're really flexible because they've done a lot of stretching or a lot of yoga, for example, in quite passive positions. We're like, right, if you can get there, you need to be able to get out of there and apply force in that range, because that's how you get injured, right? So again, training through full range of motion, whereas bodybuilders, they will tend to shorten the range slightly because they get a better pump and you know.
Yeah, but they are training for a specific goal.
Yes.
But that is the only time I have seen that.
Yeah.
And in kind of everyday people or recreational athletes, you won't get that kind of thing.
Yeah.
So yeah.
Fair enough. So desert island stretch, if you could only do one stretch ever again, what would it be?
Well, the one stretch that got me out of my issue and that I tend to give to a lot of lower back people is the elevated pigeon stretch. And because I don't have a bench now to show it on, but we can do it sitting.
Yeah.
So you would put
I love it.
one leg across.
Yeah.
And then leaning on here.
Yeah.
And good. So we can even lean in if we need more.
Okay.
Most people will feel a stretch just putting their leg up like this. And we breathe.
Breathing's important.
In, breathing out, leaning into the stretch. So we can then lean.
Yeah.
So if we would be on the massage table, which is where I normally demonstrate this, you would start by going on to full extended arms.
Yeah.
If that's okay, not too much of a stretch, you can go on to your forearms.
Yeah.
You will get more of a stretch.
Yeah.
And the reason I love the elevated pigeon is because the standing leg behind you can bend, so you can get a deeper stretch.
Yeah, sure.
You can also reach to one side to get that lower back stretched out as well.
Yeah.
And you can figure out where is the exact point you need to be to get the stretch you need.
So where should you be aiming to feel the stretch on that one?
Well, it goes all the way up into the glute. But it can, if you reach to the side, it can even go into that QL, that little stabilizer that tends to be a lot of the problems when it comes to lower back pain.
Yeah. And this is the thing, I think people often ask us that, where should I be feeling this? It's like the body will kind of inform you where the roadworks are.
Sometimes if you are very tight, people feel it actually here more.
Yeah, but
so you will feel it where you are tight, but then there are ways to, okay, let's try it this way. Okay, now I can feel it more there, you know, to kind of get around it and get to it.
Fair enough.
But the pigeon stretch is very common to do on a mat, but then we don't have the ability to fine-tune it as much. This is why I love the elevated pigeon stretch. Yeah,
one of the prompts I try to bring when doing the pigeon on the floor is to actually get people to think about pulling their back leg backwards, reaching back with the back leg rather than focusing on the front leg, which I guess kind of does the same thing as obviously we do on the bench.
Yes, so the back leg helps to intensify the stretch or get it where you want it to, for sure. Yeah.
Nice, that's good. It's a good one.
Yes, I love that one. I don't think I could live without that one.
There you go, the elevated pigeon.
Elevated pigeon. Those are my final words.
Fair enough, I like it. Cool. I'm trying to think if there's anything else I wanted to ask you about. I guess I don't want to be prying, so no, I think we'll leave it there. We'll keep everything else off camera. But I guess, when would you recommend people come to see you? Would it be the first time they're aware of an issue, or should they wait until it's a bleeding neck problem rather than and they can't walk or stand up?
Well, I always say don't push through a niggle. When it comes to muscles, and it can be anything from, oh, my neck is a little bit, but I'm okay. No, that's a warning from your muscles that something might be about to happen. So we can actually prevent injuries if they come and see me in the earlier stages.
Yeah, one of my coaches likes to say it's like the warning light on the dashboard in the car.
Yes.
If you ignore it, you're going to break down.
And then you will need to see, let's say, the physio or osteo, and then you might have weeks of stopping training and all these things. So if we can avoid that, if we can prevent, I'm a big fan of prevention.
Yes.
It's a lot easier than dealing with fixing something that's already broken.
Absolutely, like it. It's good. Awesome. Okay.
Yeah, great.
Thank you so much, Hun. That was really, really interesting.
Good.
And hopefully informative.
Yeah.
Marvellous.
So.
Well, for anyone that has watched this all the way through, well done. So Anja is in our treatment room upstairs here at the gym in North Greenwich. We are, 300 metres from North Greenwich Tube Station and bus station. So if you're local to the area, or obviously when you're working with someone such as Anja, you're not coming all the time. So if you can make the trip over, then we'll put a link somewhere on this video. I won't point because I don't want to commit to where that button will come, but it will be somewhere. There'll be somewhere to link where you can find out more about Anja and how to work with her, but I highly recommend. And thank you very much for sitting down and talking to me.
Thank you.
Thanks, Hun.
Thank you.